stricture for a simple bulbar urethroplasty takes around 2.5 hours. If you have to do it all by yourself, if you have colleagues that maybe can harvest the graft for you, you can cap the time by half an hour at least. But if the stricture, it's a long stricture, panurethral stricture, it is a complex patient because had done previous surgery and whatsoever, and length of the surgery can easily stretch up to 3 or 4 hours. So any case is different. You cannot generalize, but you know that it's not an easy surgeon. You have to be focused from beginning up to the end, because problems can happen in any step of the surgery. Even when you finish and you place a catheter, if you're not careful, the catheter does not go in the right position, you can make a huge mistake. So you have to be focused from the beginning up to the patient have a medication on it and is moving to his room bed because the surgery is finished. And also post-operative requires attention and following the patient with medications, follow up until the patient has removed the catheter, and also the day after. So it's a long process.